is essential. Really, they are the frontline workers who are, you know, the first line of defense, the ones that are reaching all the patients. So the first question I would like to address is towards Mrs. Aketi. What challenges did the West African College of Nursing see within nursing education prior to COVID-19? And how were things impacted by COVID-19? And what is the current situation, the challenges persisting within education, and the plan for the future?
Thank you, Erin. Good afternoon, good morning, good evening, where we find ourselves.
My name is Shola Aketi, the current Vice President of West African College of Nursing. I want to start by appreciating the organizer for considering it to invite my college to this auspicious occasion. Knowing fully well that nurses in the sub-region, they are doing a lot, and globally, our imports cannot be put aside. The challenges is quite enormous, but because of the limited time, I'll quickly itemize them. One of the cardinal challenges that is obvious is lack of autonomy. Nursing is a profession identified with to care for the less privileged and to care for the people in need. And as a profession, there are so many models, there are so many opportunities to progress. But this is being deterred because of this lack of autonomy. We have been advocating for this autonomy for quite a while now in order to give ourselves that expected response needed to the community that we are serving. Another, nursing, as you all know, is a skill-based program. You train those that are needed to give the quality healthcare services in the community or wherever they find themselves, because our ultimate is to restore life, to promote health, to alleviate suffering. But when you are not given that opportunity, because of the current situation, definitely it will affect the health of an individual. The COVID-19 came, like I keep saying, as a rocket on a small island, and so everybody is in the trouble sea to weather to sail through the trouble sea. So COVID-19 has really helped to increase the awareness of virtual training, to increase the capacity of an individual on a larger scope. As I'm currently telling you, we just finished a session with WHO, which we started about 11 weeks ago. It was opportune. We were able to do that because of the virtual availability, but it has its own limitation. So virtual training has really helped my colleagues in the sub-region to get engaged in capacity building. However, the education in our sub-region is really solving a lot of setback. Lack of funds to execute the needed implementation, lack of facilities. Most of our facilities are obsolete. And we don't get most of our research being conducted with our own self-sponsored funds and not even seeing the light of the day because there is no enough support for the sub-region. So autonomy-wise, they should give us the privilege. We're advocating that. The college wants that. Majority of our nurses in the sub-region are clamoring to be a consultant in their field, a clinical specialist that will be able to give the best care to our clients. But what do we find? Often than not, the people in government will not even let the nurses see get their requested needs. However, because of this, a lot of brain drain, attrition is really playing its game successfully in our region. But could it be that we have enough support, enough backup for these programs that are supposed to have seen the light of the day? I want to tell you, we have turned our West Africa to be precise, into the evening of Europe. I'm saying most of our organized programs could not be achieved because of all these factors I've earlier mentioned. May I quickly made it known to us that nurses have really played a significant role during COVID-19. So much that in Africa, as reported by WHO, in July 23rd, over 10,000 healthcare workers have been affected. And I quickly bring it to our notice that by WHO standard, about 43.8 million healthcare workers are globally recognized, of which over 20 point something million of them are nurses.
Yeah.
Nursing placement cannot be overlooked. They are very, very important to the events around us and to the elevation of our standard. And that was why we do give the credence to Boris Johnson in his remark, given that responsibility, that regard to the nurses. If other countries can do that, I think that will serve as a stimulus for my colleagues to do utmost, perform better in their various areas of endeavor. I would like to use this opportunity to kindly request that let the West African College of Nursing be given that recognition in our sub-region. That has been a challenge before now, and let all our training that we have been given across board be given also that same recognition. We promote excellence in nursing. That's one of our objectives. Our objective is to promote nursing, and how do you promote it? When you find out there's a gap, you try to bridge the gap. The gap between the tourist and the clinician is being closed. It's being closed gradually. And so you can get to the clinical side and see that the model that you use to teach your students is being practiced. But COVID-19 has put a stop to that. There's a stop gap because there's no physical interaction. There's no physical assessment. And that has to be, we have to work on that. It's really play. And we don't give the quality training to these students. How do you expect them to come out and become the best you want them to be? Not even when you are using them, the final year students come and do the clinical posting. I mean, has been considered as though they are already qualified because of COVID-19. So the government in power should find a mitigating factor, effective mitigating factor, to ensure that these students, they are being monitored, not only being trained, being monitored, being properly supervised, so that they can come out to be the best you want them to be. Our facilities should also be upgraded. Our research should also have a beautiful outlook. Many of the research we have carried out, but they are lying low because they are being regarded as their nurses. I thank God we have a professor in the house today. She's a professor of all professors. She has so many teachers, so many students that pass through her pathway, be it as a medical doctor, be it as an health analyst. But today, they still don't give that recognition to my colleagues in the sub-region. So I will use this opportunity to kindly look into that. It has been a challenge, a real challenge for my colleague in the sub-region. And Nigeria especially is a highly populous area. And so the government of today should look at it that for you to get healthy, for us to promote health, nurses should be at the front burner of events. Not that they should be given the information. They should be part of the advocate.
And what you're saying,
team, so that they can give their words and the way the research they have carried out, they can effectively implement it in the course on the discussion table.
Thank you. No, I think what you're saying makes perfect sense, and I think you've touched on something that COVID is uncovering, which is we have to build within our education the strength of the people we're training so that they have the autonomy to do what we need them to do. And it sounds like in nursing education, you've highlighted that that's incredibly important, as well as making sure we're investing in this education so that all of the trainees.
This is the time to invest. Universal health coverage covers, it really demonstrated the need of nurses in globally, not in a sub-region alone, but globally. But invest in these nurses. When you invest in something, you want a gain of such in the nearest future. So if you don't invest today, when do you want to get the benefit of what you have invested? So it's better to invest in nurses and midwives. They'll be able to reduce the high rate of under 5-year mortality. They'll be able to reduce the maternal mortality rate. They'll be able to reduce all those advice. Look at it currently. Substance use abuse has been the bane of events in our sub-region now. Because of what? So invest in nurses in order to bring this to bear. As SDGs, we want to encourage us to do so.
Thank you, Mrs. Akedi. And moving on to Professor Idioma, what challenges did the University of Nigeria see within nursing education prior to COVID-19? And how were things impacted by COVID-19? So I'd love to hear your thoughts about the current situation and then what challenges are persisting during COVID.
Thank you very much, Erin. And thank you for this program, for inviting us to X-ray to interact on this program concerning COVID, nursing education, either in the WSCN or in the university. Nursing education in UNN, in University of Nigeria, Enugu campus. The university is the third university offering nursing education that came in third. We had Ibadan as first, Ife second before UNN came into being. And I happened to be a pioneer set, you know, in that 1983 when it was established. So I think I'm the right person to really talk about challenges we are having started from there and still work there. If we begin to talk about the challenges, when we started, we only 11 students that was admitted in 1983. Yes,
11.
That's how we started, 11 students. And of course, you know, nursing is a professional course, and you need the standard and the quality. But today, what can we say? We have about 1,032 students from 200 level to 500 level. And you find that each set has up to between 150 to 200. And being a professional course is being regulated by Nursing and Midwifery Council. Yes, for you to, even if you pass your degree and you don't have the professional qualification, you won't practice as a nurse. And so at the level of 300 level, we do what we call indexing. And with a class of 71 to almost 200, and you are given only 75 to index. Mm. And why we are doing that indexing is to regulate the standard of practice, which every professional does. But when you have a number that exceeds that, what happens? There is a spillover. And that's exactly the challenge we've been having all these years. Because the public has now seen that there is value in nursing. Before, nursing was being relegated to the background. Mm-hmm. I tell you now that, yes, having been in the department for a long time and also having been the dean of the faculty, you find people who have read other disciplines and they want to come back to do nursing. Why do they do that? Because they have seen the value in nursing. And they want to come back after their first degree to register for nursing, to do a direct entry in nursing. And that's why we have this large number. The proportion has really. And how many lecturers do we have? In fact, I will tell you that even the UNN has the highest number of lecturers in the various universities we have in Nigeria. But even at that, we've not been able to meet the NUC, that's Nigeria, the University Commission. We've not been a National University Commission. We've not been able to meet their benchmark, which is 1:10. What we have in UNN is 1:43. Yes, because we have 24 lecturers managing this. I did not include the first years because the first years I do the basic nursing. So we don't even include them as part of us. So we start with 200. So the number I'm giving is from 200 to 500. Mm-hmm. So you find it is very, very difficult. The infrastructure is not there. In a class, you find people loitering outside, and at times they won't even come because there's no space for them to stay in, to listen to lectures. How can we train students? These are people that will handle lights. You know, that's the professional aspect of nursing. We are being trained so that you come out and do what? And treat people. So when you learn haphazardly, you are not in the classroom, there's no seat, you are not comfortable. How do we raise such students? Is a problem, a major challenge in the system. Now, about COVID. In March, when the school was closed, and with this closure, till date, as we are discussing now, it has not been reopened. Yes, the students have not come back to school. Mm-hmm. So we still find the challenges that were there prior COVID still in place. Yes, and we don't even know what to do with this. I talked about the spillover. After 75, if for each set that are being indexed, the others will leave and wait for. But then when you are waiting, because another set has already come in. So how do we manage the spillover? So you find that people stay more than a course of 5 years, stay more up to 7 years before they get their professional license qualification to leave the university. As I said, you may, when it is 5 years, you take your degree, but then it does not qualify you to be what? A nurse.
Mm-hmm.
So that's a major problem in the system that we are having. The number is too high, it's too large for us to maintain. And we've said it severally, you know, it looks like it falls on deaf ears, the government. It looks as if, well, we are in the university, we are talking about professional courses and whatever. But then, because it's a professional course, we have to maintain standard and quality and bring up people that will be able to look after the society. So the spillover is a problem, as I've said. So the COVID, there is no way in this COVID, even if we are going back to school, the physical distance cannot be maintained with this number. It's impossible.
Yeah.
Very, very impossible. But then looking at what others have done, because I know that in the state universities and private, they went online. But we've not been able to do that as of now. So you see, that's why the university still. So there is a plan. COVID actually, we say that the Bible tells us that all things work together for good. We're not thinking in line of online and whatever until COVID came in. So it's another way of looking at our educational system. How do we train these people? But then nursing and other professional courses, we still have to look at the clinical aspects. So it's not just the theory. Though if you just have the theory without the clinical aspects, you are not a fully trained nurse. You know, I've listened to people in the developed countries, how they have been able to manage. And when I hear their stories, I say, wow, when will Nigeria get to that stage? You know, it's the same because the COVID, you know, it was global. And people try to find a way of getting around it. But we are still where we are. So we've not been able to. The only way we can come out of it is to develop a virtual learning, in as much as it's not going to be all true, but something hybrid, you know, that will take care of this. And then government has to know that education is very, very important. As I'm speaking now, ASU is on strike. That's the Association of the University, workers. We're on strike. We've been on strike. Even we started before the COVID. So even if they call up strike, they won't go back to school.
Yeah.
So these are issues. So these are major issues government should look into. Education, whether we like it or not, is basic. Very basic. You know? So it must be something policy should look into it. How do we drive this thing?
Yeah. And we need to holistically look at the system.
A holistic approach to these issues.
Yep.
So leaving the students at home is not the best because they are going into wrong hands. So many things are happening. You know, they've stayed there for a long time. We are not advocating for them to stay. But then let's find something, a way out of this mess we have found ourselves. But coming back with that large number, with no infrastructure in place, and no, it's not the best for us.
Yeah, but it sounds like if we can use the COVID pandemic to identify some virtual learning opportunities, some ways to manage the training so that everyone gets the attention they need to actually become a fully trained practitioner, and we look at the system, we may actually be able to use this time to improve the system even when COVID is gone. But you're right, it's going to take commitment and
it's going to take commitment and dedication from the lecturer. We are thinking about that because we can't allow our students to stay for this length of time. And from the government. When we train them, we lose them to the developed countries where they get satisfaction, you know. So we lose our best brains over there. You know, by the time they are in 500 level and they are graduating, you find people coming there to recruit them.
Exactly.
Because one, there is no work. And you won't allow these people to go to the private where they are being given a peanuts. After all these long years in the university. So we train them and then they move out. So it's a problem in the society, in the system.
Absolutely. And I think we often associate brain drain, which is what you're describing, which is highly trained people leaving. with physicians. But you're absolutely right. With highly trained nurses, there's significant demand for them around the world. And I want to, Bunmi, I'm thrilled that you have joined with a stable network connection. You are much more qualified to lead this conversation than I am. So I'm going to
no,
pass.
You're doing a good job.
Oh, thank you. I'm going to pass the baton to you, and if you don't mind introducing yourself, and then I'm happy to let you lead and moderate the discussion.
Okay. It's quite an exciting time for me. Trust me, when we're discussing nursing, because of course, if not for anything, for the fact that this is 2020, the year of the nurse and the midwife is really, really important. So by way of introduction, my name is Comrade Bunmi Lawan, the CEO of Spinal Care, Spinal Bifida and Hydrocephalus Care Foundation, and the lead nurse for Global Initiative for Children's Surgery, GIGS. It's an exciting time to sit at the same table with my very senior colleagues, my mentors, the people I call mothers, mother of all mothers. So I want to say a very, very big thank you for the Vice President, West African College of Nursing, in person of Mrs. Shola Aketi, who I have a lot of respect for. And of course, my strong mentor, who I look up to, because some days I want to be a professor like Professor Ijeoma too. And I'll also be privileged to work with her. She's very focused. She's a very committed leader. And I want to say thank you to Professor Ijeoma for joining us this afternoon. And I want to say a big sorry because the network in Abuja, Nigeria, is not quite stable. There's a big rain going on right now and affects our network. Thank you so much. And thank you so much for standing by, standing forth, Erin, for me. And to move on quickly, just to also save time, I think we have to get Dr. Micah presentation right now. I'm sure they've done the introduction. So please quickly we'll invite Dr. Micah to take his presentation. However, I want to say that Professor Ijeoma have said a whole lot looking at developing an hybrid virtual learning system, which the government needs to invest on. The donor agency needs to pay attention to all of this. So it's actually a call for action for everyone who is listening to us now, particularly the partners and our government, to please make an investment on virtual education. Thank you. Over to you, Dr. Micah. Thank you so much.
Thank you, moderator. Thank you, panelists. Let me put on my video. From Nairobi, Kenya, it is cold afternoon or evening rather. I want to right away talk about the issues of the COVID and the COVID period and how it impacted on nursing education and practice in Kenya. Of course, one thing I must say is that in Kenya, nursing education and midwifery education, they are very heavily regulated by the Nursing Council of Kenya. And before the COVID period, of course, I would say our standards in the country is that we have 1 tutor for every 10 students in training. Also, in our country, we have 156 nursing schools at the moment. And you all know that nursing training in Africa is comprehensive most of the time. That is, the syllabus covers both nursing and midwifery. Although we have a few schools which offer only midwifery training, about 5 schools or so in the country. And that is a very exponential increase from 2014, when we had only 84 schools. And about 6 years later, they have increased to 156 schools, which admit about 3,000 students every year. Every year, we admit 3,000 new students doing a diploma, degree, and a certificate courses in the country. Of course, the challenge has been in infrastructure, that we have more students than the infrastructure. The clinical areas are very congested. You have fewer mentors in the clinical area. Although the Nursing Council recommends 1 mentor for every 10 students, you realize that sometimes a mentor has even 20 students that he's looking after. We have tried to encourage one preceptor to 2 to 5 students, but we find a preceptor sometimes at 10 students in a shift. Basically, what I'm saying is that we had various challenges in nursing education. Of course, again, knowing that most of the schools are using conventional training approaches, whereby students are resident, so they go to class each and every day for face-to-face learning. But as Amref International University, being the current successor of the Amref International Training Center, we have been using e-learning training of nurses for the last 10 years. And I think we are the pioneer institution to embrace e-learning in Kenya, and I think in the region since the year 2006 up to now. And we have been able to train over 15,000 nurses in Kenya and the region using blended e-learning approaches. So allow me right away say that although we have been implementing these approaches that are innovative to train nurses, 90% of the schools in Kenya, they don't use e-learning methodologies. They don't use innovative training methodologies. And what we have seen during the COVID period, I would say basically 90% of the nursing schools are closed. There is no learning activity that's going on in the 156 nursing schools, except maybe 5 schools in the whole country, whereby Amref universities included. We have been running our programs in nursing training since March when COVID cases were diagnosed in Kenya. We have now finished 2 trimesters, all programs operating on e-learning. Students have done exams and their programs are going on. The only challenge that we have faced is the clinical practice areas, because the government has set up rules that we have to ensure that our students are not in the clinical areas to minimize the risk of them contracting the disease, and also to ensure that there is no congestion in the clinical areas. So I will say from the training institution side, the students have been able to cover their curriculum, except for the clinical placements, which we are waiting to see how to address them when the restrictions for COVID-19 are lifted by the government.
All right.
Allow me say this, that as a way forward, and this is something I must say, of course, most of the nursing educators in our developing countries, most of them are not capacity built to use innovative training methods. Most of our nurse educators, they have been trained to over what I'll call traditional methods of teaching. They are not prepared to use innovative teaching methods. We don't have lecturers or nurse educators in our countries and the region who have been well trained to develop distance education learning material. Pedagogy has not been embraced well in developing distance education resources among the nursing educators. And this is one of the areas we need to address. And I'm happy to say that for the last 10 years, personally, I've been heading the program of blended e-learning in Amref. We have been able to do some capacity building in about 6 countries in Africa, and more so the East Africa region and part of West Africa, the Francophone Senegal country. But we are keen to build capacity even in Nigeria. Let me say that as we are speaking here, I have a proposal which is lying with Health Markets Africa in Lagos. They had approached Amref University to support Health Markets Africa, build capacity in Lagos among nursing schools and educators on how to use e-learning methodologies to train students. And I'm waiting for that response because we are always eager to build capacity on how to write content that is to be rolled out through e-learning, and to train lecturers more so on how to use innovative training methods in training.
Thank you. I have to come back to you, sir.
Allow me switch over to the practice side, because the question I was asked is a 2-pronged question, nursing education and nursing practice. The practice side is equally challenged by the COVID-19.
Yeah, Dr. Michael, sorry, please. I need to stop you from it.
The panelists know, we are carrying the burden of 25% of the disease burden in the world. And we are having starving ratios which are below the WHO recommendation. So basically, COVID-19 attacked countries which already are having compromised
Thank you so much.
Dr.
Michael.
Yes.
Sorry, I need to cut you a little bit to get back to you. It's quite difficult to say you should stop, but really we want to come back to you. Thank you so much. It's very, very important to emphasize the fact that one of the major problems we have when it comes to nursing education is the structure, as you have mentioned. And I'm also happy that even despite the COVID-19, your school has completed 2 semesters. That is amazing. And trust me, with the Nigerian, we are looking forward to partnering with your university. Thank you so much. So moving forward right now, thank you. So moving forward right now, I want the participants to please use the Q&A section to communicate with us, write your questions, share your stories. And again, do not forget to introduce yourself. We are glad and we want to meet with you. So we'll quickly move to Mrs. Atinuke, who is going to talk to us on the challenges that we are facing prior to COVID-19 and at the heat of COVID-19. Again, looking at way forward, what do we expect from the clinical perspective? Over to you, Mrs. Atinuke.
Thank you very much, comrade. And I want to appreciate everybody, the panelists, Erin, and all the organizers of this program. And thank you for this great privilege. Yes, we all know that nurses are on the front line, and we have a significant role to play in caring for these patients. But it's rather unfortunate, even before COVID-19, that we were having a lot of challenges in the areas of manpower, just like my former speakers have been saying. But this will divide into 2 parts. Number one, from the government part, they are not employing enough nurses. And secondly, even the little they employed, we are not being remunerated very well. And this is causing a lot of brain drain among nurses. Our good hands are leaving for developed country. And so on this, because of this shortage, we have a lot of work overload. Nurses are just laboring. We stretch ourselves beyond limit to care for our patients. And unfortunately, while even trying to do this, at least to give our best, that's what we love doing to our patients. Please. Hello?
Hello, we can hear you, ma'am.
Okay. So I said it's rather unfortunate, even while we are trying to still give in our best to these patients, we have insufficient personal protective equipment. And without this, and even in other areas too, ICU capacity in most of these hospitals is insufficient. And now, it's nothing to protect ourselves, nothing to protect our patients from contracting all these diseases. And so because of that, you see nurses working under tension. They are stressed, they are afraid, they don't know what to do. And eventually COVID-19 came, the pandemic. And the whole thing now became escalated. We were talking of a shortage of manpower before COVID-19. Now it had to be that we have to move nurses from less busy areas to high-risk areas. And so leaving other essential services not being really catered for. And so even the nurses that are working there, you see them running up and down, helter-skelter. They don't know what to do. They are afraid. They are physically exhausted. And then the psychological changes, so many of them are not sleeping. They don't want to contact their family, they don't want to contact give the infection to the community. And all we need to do despite the fact that we kept on hospitals and not advised that this thing had been on, not within. If the administrators will please look at what nurses are experiencing in the area of clinical care, and then develop targeted intervention strategies so that at least things can come up and things can change. And then possibly we have to put some nurses in the policy, at the policy level, where we will have voice and then we'll be able to speak for our patients about. I feel maybe along the line when you begin to ask questions. But for now, there's high risk of infection, both on the nurses side and the patients. Thank you.
Okay. Thank you so much, ma'am. My own ADNS, if I'm very correct,
yes,
Mrs. Catherine, for that
yes.
brief. Thank you so much, ma'am.
Yes,
Thank you very, very much. And I want to, yes, ma'am, I want to say that what you're saying is actually the fact, because I'm a COVID-19 survivor. And when I was on admission, I could see my colleagues who really want to help, but there's no PPE. So this is the call for action.
Yes.
And I hope that the government, the institution, will invest more in nursing so that we can do what we need to do and what we have taken pledge to do. Thank you so much. And quickly, I want to
God bless you.
Go back to, yes, ma'am. I want to go back to Professor Ijeoma. Prof, ma, at this time, if you could just discuss with us, how do we marry e-learning and the necessary prerequisite for hands-on training during COVID-19? How do we marry that? We are advocating for e-learning. That is okay. But again, we know that nursing is very significant when you can practice. So how do we marry that? The importance of e-learning and the fact that as nurses, we need hands-on training. Over to you, Professor Ijeoma.
Thank you very much, moderator, Umi, my good friend.
And your daughter.
My daughter. She really worked.
Thank you so much, ma'am.
Yes, when I was the Nigeria chapter chairman hosting the DGM at Abuja, that's when I came across her. That's a very pertinent question. Just like Dr. Mike was saying, there is need for us to embark on e-learning down here. We've not done it before, but then there's nothing, you know, COVID has changed the whole landscape of learning. So we must have to imbibe e-learning. But the question now, you talked about the clinical aspect, but imbibing the e-learning, you know, again, not just for the students, the people who are the educators have to build their capacity. I think he mentioned that.
Yes.
There is need to build capacity because this is something new. We've not used it before. So we can't just dabble into it. So we learn from people who have already used it and who are still using it and see how it has worked. So there is need for training and retraining, you know, in this era that we find ourselves. Now in the clinical area, yes, as I said earlier on, nursing it has to do with skills. But, you know, in the developed countries, they are very wonderful people, the way they think. There are simulators. You know, I was discussing with one of my students, so there's something he wants to bring out. So the way they have fashion, because I was asking him, how do you now do the practice aspect? He said, wow, everything, you know, they have the video, everything. So you go online, they have them well prepared. The thing is that when we begin to look at our country, we say, can we do this thing? But we have to borrow from the developed countries. Okay. But then that's where the support has to come in. The support with nursing education, nursing cannot do it alone. We need support. You know, just like in the developed countries, we see NANA. NANA is a nursing association in North America. They've come down to help us. Catherine, I heard Catherine talking about PPE. They have supported us a lot. These are people from abroad. Nurses, when they hear that nurses are working without anything, they have come down to help us to do things like this. So there is need for us to get support. Okay, there is a way, always a way out.
Yeah.
So we can also do clinicals. It's been done in the developed countries. And of course, we can also divide small, as I say, it's a hybrid learning, way. So it's not virtually going completely out of face-to-face or physical contact.
All right, fine. Thank you so much, Prof. We'll get back to you very soon. And it's so very important to note that even nursing, we need collaboration, support from partners, from government. Again, we are looking at sustainability of this program. So which means that the government must take interest to the largest group of healthcare professionals. I keep saying that nursing and nurses, we are the nucleus of healthcare system. Without nurses, there's no healthcare delivery. Thank you so much. And right now, to quickly go to my own boss, I call her boss, Mrs. Aketi, to address one of very important questions by one of our participants this evening by name Emily. She says, and I quote, thank you so much for the insightful section. The pandemic has taken a toll on mental health of nurses. How are you helping nursing trainees who have been thrown in deep end of handling patients? Over to you, my own VP, VP1.
Sorry, you need to repeat the question because the network logged me briefly. It was intermittent.
Okay, so the question by Emily is, the pandemic has taken a toll on mental health of nurses. So she is looking at mental health of nurses. How are you helping nursing trainees, the nurses trainees, who have been thrown in deep end of handling patients? So the mental health of our trainees, how are we helping them? Thank you.
Thank you very much for that question. As a matter of fact, one of the pillar said during this COVID-19 is psychosocial pillar. And that psychosocial support has really worked on our healthcare workers effectively at the primitive stage of this COVID-19 affectation. Like I said, we have a lot of our healthcare workers in the sub-region getting affected. But the intervention of the psychosocial support or team really helped us out of the situation. Everybody's afraid, they don't want to touch. When we talk of PPE, they want to wear the raw, dressed as somebody going to the moon, not assessing, not carrying out the risk assessment of the so-called clients. So the question you asked me, the impact of mental health on nurses and nurse trainees caring for COVID-19 patients, they are highly enormous. And so at the initial onset, like I said, the fear, the whatever came to be, but their approach by doing it themselves. Like I used to visit, monitor the isolation centers. But because of this high rate of index cases, I chose to now partake in the care. Partaking in the care is a medium of calming down, if I may use it, like my governor said sometimes ago, calming down the healthcare, the frontliners that see, this thing, with this thing, you are sure of coming out of it effectively. Like my other panelist said, availability of PPE. That is the area I would like all our partners to look into. That by the time our students get back to the classroom, as in conventional, before the hybrid virtual, really take a significant role, the face-to-face learning still need to come up. But there's a need for all institutions to be supported with PPE.
All right.
They don't have enough PPE that know how they can engage or they can discuss with this training. And at the same time, our facilities should be upgraded. They should look into that. Because most of our facilities, they don't have that distance learning. They cluster in the small classroom. So a lot of development should be done and assistance.
All right. Thank you so much, ma'am, for that recommendations. And the time is fast spent, but I also want us to take this last question. Any of our panelists can please give it a shot. And it says the school The school is an environment that supports excellence and inclusion with values which include capacity for innovation, new opportunities and practice, but with interruption of COVID-19. How is the nursing education reinventing itself in this regard? And what is the essential to preserve the nursing training process? So what is essential? Fine, we have talked about partnership, the structure, but what are other things that are essential to ensure that we preserve the nursing training process? Thank you.
Thank you very much, moderator.
Before Prof says something,
there's no
area of practice.
Eh? Okay.
I'm saying something.
I'm trying to say
number one, for us to have a long-term effect or whatever we have been discussing, the reduction in the nurse educators should be replaced, and they should be well cared for. I said this because they have good brains, they are important personnel that we can make use of to train other people. But when they are not giving them attention, attrition in today's hospital setting and clinical setting is enormous. So let them look into the need of these nurse educators and give it to them. Most of their research should be looked into and be given support.
All right.
The government of you've spoken to our sub-region, they should give enough collaboration to most of our nurse educators, most in the area of their research, so that they can be the best.
All right. Thank you so much, VP1. Quickly, let's move to Professor Ijoma. One statement, ma'am, on that.
Okay. Thank you, moderator. You know, the world is changing, and nothing is static. She's talking about reinventing. There is no way because of COVID, we'll stop nursing education. No. Other professions did not do that. So it will not start with us. So how have others come about it? That's what we should look at. So if we find out ways that others have gone and they are successful, we should go into that. That's one thing about nursing. We should not be starting, we should be moving. Find out what others are doing that are working, and then we'll do. So this e-learning has come to stay. COVID has come to stay. For it to go, so we cannot continue to depend on our traditional way of doing things. It does not work, it cannot work. And therefore we have to move forward and then embrace what others are embracing. And but then, as I said, there must be capacity building. And our nurse leaders, I think this is a time to talk to our nurse leaders. We are not at the table, we are the menu. We should be where others are. You know, looking at issues, the way others are looking at it. You know, so that when it comes to nursing education, we'll be able to profile solutions. But when
Thank you so much, ma'am.
We do not have the opportunity, you know, to say what is happening in nursing, whether in the practice area or in education. So that's the problem. So the nursing leadership has a part to play.
Yeah, of course, I agree with you absolutely, my Professor Ijoma, my own mentor, that nurses leaders have a role to play in boosting our level of education when it comes to nursing. Quickly, can I have your last word, Dr. Michael? Please, can I have your last word on this topic? Thank you. Over to you, ma'am.
Thank you, moderator. I want to respond to the question that one of the participants raised on how we can ensure that nursing education fits itself, reinvents itself, and fits into the context which are emerging from time to time. My honest take is that if we keep saying that nursing education or nursing is a science, and the science should be able to adapt to the emerging situations. And if we cannot adapt to emerging situations, then let us not say that nursing is a science. Where we are at the moment, we need to think of how we can adapt to COVID situations and other future pandemics or future related contexts, and look at how do we change our policy landscape, because I think our policy landscape in nursing education in developing countries is not aligning with some of these emerging situations. What I mean here is how can the regulatory bodies provide direction to the training schools on delivery of innovative training methods. What should schools put up as infrastructure for them to deliver e-learning? What kind of training lecturers need to have for them to deliver e-learning? What kind of skills labs do we need to have in schools for us to offer a simulation-based learning? Because by simulation-based learning, we can do virtual training for the students. How much percentage of training can be virtual and how much can be physical within the clinical area? It's not a must that we continue doing the Florence Nightingale model of training, whereby we're doing psychomotor-based learning most of the time. We need
Thank you so much.
science-based models or scientific-based models, but we don't leave out the clinical practice component. So in the virtual training space, regulators should tell us what percentage of learning should be virtual, what percentage should be physical, so that we don't bring learning to stand still 100% because of COVID-like situations. Allow me also talk about what do we need to do in terms of curriculum adaptation. Most of our curriculum, most of our syllabus is quite traditional, is quite conventional. What do we need to do so that nursing education reinvents itself in terms of having a syllabus which embraces innovative models? We have now M-learning, we have e-learning, we have even MOOCs, massive open online education for various professionals, and why not nursing? So
thank you so much.
There are so many things we can do to ensure that nursing invents itself and fits itself into the emerging situations.
All right. Thank you so much, Dr. Michael. I know that time is not on our side, but the final word from my ABNS catering. Over to you, just a final word, one word. Thank you.
Thank you very much. I really appreciate this. All I have to say now is that we should please have a way of allowing these students to come to the clinical area. They have to learn on the job. It's not a matter of e-learning or e-training. Nursing is known to be a profession of touch. You cannot talk of nursing or talk about nursing without patience. The skill of touch, you need to come very close to your patients. If we are talking of e-learning, if we are not teaching them how to be prepared during infection outbreak like this, then what are we saying? There should be a plan into the clinical site, but at least the necessary equipment and items ready for them to use. If they don't practice it now, they will continue to be afraid. They will not want to come near the patient. They will not want to come to the clinical site. Everything cannot be on the line. It cannot be trained. We still have to bring them into the teaching. I mean, they are nothing.
That's the hybrid. That's hybrid, the hybrid we are talking about.
Yeah, thank you so much. I will take it up from there, and I want to say that yes.
Okay.
Thank you so much, ma. I want to say that yes, we know that nursing, we really need that science of thought. But again, as one of us have said, nursing as science should align itself with matching situation. That is a key word. That is a key word. And on this note, I want to say we have to come to the end of the presentation because time is done, our friend. Trust me, it's good to go on and on. But I want to also remind our participants to know that your question will be addressed to, we'll share it with our panelists, and trust me, we'll get the feedback for you. On that note, I want to say the nursing workforce comprising nursing professional and nursing associate. It is the world largest, I say, single occupation in the health sector, and is a foundation of the interpersonal health team that deliver on the promise of health for all. And of course, State of Nursing World Report 2020. And permit me to call on Mrs. Nkiruka Obi, Smile Train Program Director, West and Central Africa, to give us a vote of thanks and closing remark. Over to you, Mrs. Obi.
Thank you.
Wow, this is putting me on the hot seat because I was somehow enjoying the flow.
I said we should not go.
Engaging, super stimulating session. I'm so proud to be part of the story of today, how we are, moving forward, reinventing nursing, leveraging on every available platform to ensure that nursing education is still solid and is still very relevant in providing the necessary health care for our people. I really want to thank the organizers of this webinar, especially Smile Train and Amref, and of course the West African College of Nursing. I want to thank the president. I want to thank our VP1, Mrs. Aketi. I want to thank Prof. and Dr. Micah, and of course, Madam Catherine from UCH Ibadan.
Thank you.
Absolutely fantastic. I have enjoyed the session all through, and I know many of us have also had a great time. So the journey has just begun. Let's continue to raise the profile. Let's continue to engage ourselves even after the webinar, and let us continue to do what we know how to do best, promoting excellence in the quality of care we give our people. I want to thank Erin and Sarah and also my team here. So thank you all the participants, and God bless you for making our time to join us.
Thank you.
Thank you.
Thank you. Thank you.
Thank you.
Thank you, Prof. Thank you, VP. Thank you,
Dennis,
Catherine. Thank you
Nice
so
to
much, Dr. Mike.
Thank you, Dr. Mike.
I didn't see your
Thank you,
face.
Sarah.
Mrs. Obi.
Sarah and Erin, we appreciate you.
Bye-bye, everyone.
Bye. Get back to you, Dr. Michael.
Thank you.